Good afternoon. I want to welcome everyone to the Ms. Magazine Forum on Reproductive Health and Rights Worldwide. My name is Kathy Spillar. I'm the executive editor of Ms. Magazine, and I will be moderating today's panel. I wanted to welcome our panel this morning. We have four leading experts and advocates for women's reproductive health and family planning. Joining us today, Dr. Solomon Orero of Kenya, Dr. Nafis Sadik, former director of the United Nations Population Fund. Both Dr. Orero and Dr. Sadik are receiving the Eleanor Roosevelt Global Women's Rights Awards next week, presented by the Feminist Majority Foundation in Los Angeles. And we're kind enough to come early to Washington and be part of efforts over the next couple of days to meet with members of Congress about this very critical issue of international family planning funding. Also joining us today, Danielle Pellegrom of Pathfinder International and Eleanor Smeal of the Feminist Majority Foundation. I'm going to just briefly put today's panel into context. And then each of our panelists are going to make a presentation, and then that will leave enough time at the end for questions and answers from both the press and from advocates and participants who are here today. As many of you know, in the winter issue of Ms. Magazine, copies of which are on the table and in your press kits, we issued a special report on U.S. international family planning policies and their toll on women in the developing world. Although the United States is the largest donor country in actual dollars spent on international family planning, the U.S. contributes only about a third or less of what it promised, along with other donor nations in 1994 at the United Nations Conference on Population and Development, in order to reach universal access to family planning and reproductive health in the developing world. Each year, funding falls short worldwide by some $7.5 billion to meet the world's family planning needs. In fact, overall, donor countries are now contributing just over half in real dollars what they were contributing in 1995. So the amount of real dollars available for international family planning is decreasing. And significantly more of that budget is now devoted to fighting HIV/AIDS. Less of it proportionally is devoted to family planning. Over the last decade, U.S. appropriations for international family planning funding have fallen by 40% in real terms. And now President Bush has proposed further cuts in his fiscal 2009 budget. Additionally, this administration has imposed harsh restrictions on U.S. international family planning aid and increasingly demanded that money be spent on abstinence-only programming. The global gag rule prohibits funding programs in developing countries with U.S. monies that use their own funds or other countries' funds for referring or counseling on abortion or for advocacy. And as a result of the global gag rule, supplies of contraceptives by the United States to some 20 developing countries now in Africa and Asia have been cut off. Inadequate family planning funding and inadequate supplies lead to higher unintended pregnancies, and as a result, higher rates of maternal mortality from illness and complications from pregnancy, as well as from unsafe abortion. Every year, an estimated 536,000 women die from pregnancy or childbirth-related causes, and an estimated additional 70,000 women die every year from botched, unsafe abortions, either self-induced abortions or performed by untrained non-medical personnel. These deaths are mostly preventable, and not to mention the millions more women who are permanently or temporarily injured. I'll try to put that into perspective. One woman dies every minute of every day, needlessly. Many of these women leave behind children. In fact, it's estimated that more than 1 million children are orphaned every year because of maternal deaths, preventable maternal deaths. Many of these children themselves will die because their mothers were largely responsible for their feeding and clothing and for their education. Current U.S. policies are contributing to this death and injury. Currently, as you know, the U.S. Congress is debating whether to increase international family planning funding. Advocates are pushing for $1 billion, which will be more than double the current U.S. contribution to international family planning funding, but still less than what the U.S. should be doing. Also, of course, there is the effort to restore funding to the United Nations Population Fund, which the Bush administration unilaterally has cut off funding for the last 7 years. A large coalition of groups are working together, many of them here today, their leadership and their advocates, to win the $1 billion allocation and to remove or at least ease many of these restrictions. Our panel will look at all of this afternoon. First, Daniel Pellegrom will address how current U.S. policies are impacting the ability to provide effective family planning and reproductive health to women in developing countries. Dan is president of Pathfinder International, and since 1985 has led its family planning and reproductive health programs in more than 20 countries worldwide.